Welcome everyone to the session, Understanding Treatment Options, What Treatment is Right for You. My name is Jill Goth, and I'm the Manager of Programs and Public Policy from the Southern Alberta branch of the Kidney Foundation in Calgary. And the information shared in this session is not intended to be medical advice. We recommend that you speak to your doctor about your own individual situation. People living with kidney disease are faced with lots of choices when it comes to treatment options. And along the kidney journey, there are several transition points where you might need to or want to change your treatment. So in this session, you'll hear from Tracy Zeiler, a kidney nurse educator, about various treatment options and learn which one might be the best for you along your kidney journey. And you'll also hear from a patient partner, Justin LaRue, who has experienced all treatments firsthand. And you'll hear about how Justin managed these transition points, all while balancing family, work, and kidney care treatments. And now it gives me great pleasure to introduce you to our speakers, Tracy Zeiler and Justin LaRue. Tracy is a registered nurse who, as a new grad, worked on the inpatient dialysis unit in Calgary. And from there, she branched out to working in the emergency department and the operating room, then moved to working on hemodialysis unit and peritoneal dialysis clinic. 9 years ago, Tracy was fortunate enough to move into the role of kidney modality educator with Alberta Kidney Care South here in Calgary, where she has had the privilege to work with patients about the different treatment options that are available. In partnership with the Kidney Foundation, Tracy presents kidney health sessions to various community groups and to the Mount Royal University nursing students. And as well, she presents in-person virtual kidney health sessions with the Alberta Healthy Living program. And Tracy's a long-time volunteer with the Kidney Foundation of Canada. And Justin LaRue was diagnosed with FSGS at the age of 31. Justin has experienced all forms of dialysis, and in 2013, he received a kidney transplant from his cousin's wife. Justin's experience with several modes of dialysis is something that he draws upon in his role as a longtime Kidney Connect one-on-one peer support volunteer with the Kidney Foundation and as a member of a community advisory committee. Justin enjoys spending time with his wife, Ruth, and 3 children, Chanel, Nicholas, and Nate, and new granddaughter, Lennon. And just again, a reminder, if any questions pop up along the way or some thoughts, please submit them through the Q&A box. And so now, Tracy, over to you.
Thank you so much, Jill. I really appreciate that introduction, and I hope everybody can get a little bit of information out of this session. I'm very excited to work with Justin and have him tell his journey and his story as we go along. So just remember that everybody's kidney journey is unique to them, and it varies from person to person. And always know you have a whole team behind you, including the nephrologists, the nurses, dietitians, social workers, and often more. Definitely make use of the vast resources that the Kidney Foundation offers, including the peer support program, which Justin is part of as well. Again, I'm very excited to work with Justin through this session and listen to his journey. I've been a registered nurse for the better part of 3 decades, and I think for about 18 years of those is when I first met Justin. I was fortunate enough to meet Justin in the peritoneal dialysis clinic when he first started on dialysis, and I was able to work with him and with the education to help him be able to be successful doing peritoneal dialysis at home. So that's always been a blessing for me. And Justin's always been a very great inspiration for me because he has transitioned through so many different options or treatment options, and all while, as Jill mentioned, doing it with a family. He got married, had children, went to school, and was working. So Justin's journey is a huge inspiration for me. So as we review the dialysis options, please know that each of the options do a really good job of removing the toxins in the water. So it's really important to pick that option that works, it would be the best for you and what's going to give you the best quality of life. The picture we're looking at right now, this is Justin's first kidney march, and he was on dialysis at the time. So it's a huge accomplishment to be able to do that. So I'm excited to hear more as we go along. I had a gentleman a few years ago tell me that he made dialysis fit his schedule and not him fitting dialysis. And I've always remembered that because that's true. You want your treatment option to fit with your life and what your schedule looks like. So we're just going to talk a little bit quickly about pre-care and what that looks like. So that's what the care that's required before transplant or dialysis. I love this quote from Michael. It says, "The journey is not easy. There's often many bumps in the road, but with a good attitude, good support system, kidney patients can find a way to live a healthy and productive life." And that is really true. It's really important to build that support network, find those people that are important to you, and keep them close to you. Try to be as physically active as you can, eating healthy. That's where working with a dietitian comes in. And then just be a really active member of your care team. And it just makes that whole experience a little bit easier to handle. So kidney disease management, the good thing to know that for many people, kidney disease actually can be managed for many years with diet and medication. So a lot of people with kidney disease may not progress to needing transplant or dialysis. So that's great to know. Once your kidney function gets around that 15%, then your healthcare team is going to start talking to you about the different treatment choices that are available. And there's a few options that are available. So again, it's important to get the education, listen to the information, and pick that option that will give you the best quality of life and work the best with what's going on in your life. If you making those decisions early helps a lot as well, because then your entire team along with you can plan and make those decisions, and your journey to transplant or dialysis can be a lot smoother. If you don't make a decision about which treatment you may want, then you may not have a choice on which treatment you start. So then you may be starting on a dialysis option that you may not want, and then you may have to look at switching to a different option down the road if you choose to. So just a little bit about exploring our treatment options. There's a lot to think about when you're discussing your treatment options with your healthcare team. There's so much information. The Kidney Foundation has really great resources to review all of the information that's available, along with your kidney healthcare team and that person that's going to be helping you learn or educate you about the treatment options that are available. So some things to consider. You want to consider the medical conditions that you might have. Consider your health goals, like what do your health goals look like in the future, and also your personal circumstances. And really important to take the time needed to explore all of your options. There are 3 main treatment options that we're going to talk about. But first of all, I'd like to switch over to Justin for a few minutes and just tell us a little bit about how your journey through the pre-care or when you were first learning that you had kidney disease. What did that kind of look like for you?
Yeah, thanks, Tracy. It's going back a while here, but it kind of feels a little bit like I was a student of yours, and I graduated. I went out to the world, and here I am back telling my story. So, kind of full circle. So it's kind of neat. For me, in the beginning, it was kind of one of those things where I wasn't really aware. There was no symptoms. I didn't really know that I had kidney disease until I wasn't feeling well. I went to the doctor one day, did some blood work, and realized that I had high levels of protein in my urine. So with that, we kind of investigated a bit more and found out that I did have a kidney disease. And so pre treatment, for me, a young guy with a family, there was a lot going on. I had to digest, first of all, that my kidneys were shutting down. And then kind of started talking about the next steps. And for me, I'm kind of a person that when things hit me, I kind of go, okay, what do we do to move forward? So I went into it with an open mind. I didn't really have any ideas, good or bad, but just kind of like, let me know what I need to do. How do I go from here to there? And who's going to be involved? So one of the things I did was I asked a lot of questions about the disease, about my health, about what I can do. Didn't really know a lot about treatments until I met you. But yeah, prior to the introduction, in my case, I didn't really have an idea of what to expect. So yeah, it was different for me.
Awesome. Thanks, Justin. So I'm just going to go through some more information, and then we'll have lots of time for Justin to tell more of his story, which is incredible in my opinion. So there's 3 different treatment options that are available. So there's dialysis, either home-based or facility-based. And the home-based would be peritoneal dialysis or home hemodialysis. And the facility or clinic-based would be hemodialysis. There's also kidney transplant, which we're going to talk a bit about in a little bit. And then conservative care or conservative therapy. We're not going to discuss conservative therapy too much today, but just I believe we were going to put a link in the chat just to get some more information about conservative therapy, but just know that conservative therapy is when a person chooses not to start dialysis, essentially with the knowledge that that person will pass away. So for somebody who may think that the dialysis options may not be beneficial, or they're 102 and they decide dialysis won't work for them, they may choose conservative therapy. But we're not going to discuss that as much today. So let's talk about doing dialysis at home. Peggy says it perfectly. After crash starting dialysis in 1979, she had done almost every treatment modality offered, including 2 kidney transplants. She's currently doing home hemodialysis, which allows her to have control of her treatment with less travel to the clinics. And that says it in a nutshell. So things to consider with home dialysis. We're going to start with the home dialysis first because Justin started on peritoneal dialysis, which I'm going to explain, and then we'll go through. So I wanted to correlate it with his dialysis and treatment journey. So with home dialysis, just know if you choose to do a treatment option at home, you will be given extensive training for both peritoneal and home hemodialysis. You'll need to speak with the home therapy team as to when and how often that training will occur. It varies, but just know again that you will be given proper training to be able to be safe and comfortable at home doing your own dialysis with support of your kidney care team. You'll need to make sure you have space in your home to store the dialysis supplies and also set up a comfortable place for your dialysis machinery. You will be taught how to order those supplies, and those supplies will be delivered right to your home and generally to the space that you want them. So they won't leave them somewhere where you have to move all, the boxes of supplies. Someone must be home or other arrangements need to be made to accept the deliveries of the dialysis supplies. You may also be able to claim a tax deduction for the space in your home that's used for storing your supplies or any costs the dialysis center does not cover to make changes to your home to accommodate your dialysis. Some other benefits of doing dialysis at home, such as peritoneal and home hemo, just allows you to do your dialysis more frequently. So by doing dialysis more frequently, you're getting more removal of those toxins and water. So by doing that, people generally feel a lot better by being able to remove those toxins and water more on a more frequent basis. It also, for those that are looking to start a family, more dialysis is actually needed for those that are pregnant. So that's a good thing as well. There's often less dietary and fluid restrictions as you typically would be dialyzing a lot more often. So peritoneal or home hemo, what does that look like? So both peritoneal and home hemodialysis, as I mentioned before, the training is provided. The nurses will not send you home until you're safe and comfortable. They'll make sure that you're able to be comfortable enough to do your treatment at home. Peritoneal dialysis can provide more flexibility for traveling as the supplies can be delivered to many countries around the world. So what is peritoneal dialysis? So peritoneal dialysis is done using a solution instilled into the peritoneal cavity through a tube in the abdomen. So the peritoneal cavity is basically the empty space in our tummy. The tube would be put into your tummy, and then there would be a solution that would go into that empty space. And that inside our tummy, there's a membrane called the peritoneal membrane, and that's acting as a filter. So doing the job of the kidneys, attracting those toxins in the water from within your body, crossing over that membrane into the solution that's sitting in your tummy. There's 2 different ways that peritoneal dialysis can be done. So the fluid can only actually stay in your tummy for no more than 6 hours. So peritoneal dialysis can be done during the daytime or it can be done at nighttime. So the daytime would be done about 4 times a day, 20 to 35 minutes each time you do it. And then the nighttime one would be done using a small machine about the size of a printer that would be done overnight while you're sleeping. Now, why would someone choose to do home dialysis? So with support from your dialysis team, you absolutely can manage to do your own treatments at home. And that's where the training comes in, so they make sure, again, that you're safe and comfortable to do your dialysis at home. So dialysis at home allows for more flexibility, independence, definitely more control over your treatment. You can do it on your own schedule, and you can also work your dialysis around what your day looks like. So people who want to continue working, attending school, those who want to travel, and often those are often people that will choose to do home dialysis, or anybody will choose to do it, depending on what their life looks like. People who live far from the hemodialysis unit may prefer to spend their time at home doing dialysis as opposed to traveling to and from the hospital or clinic. So back to Justin. So he went through pre-care, and now it was time for him to start peritoneal dialysis. Justin, can you help us out and tell us what that kind of looked like?
Yeah, you bet. So yeah, in the beginning, when I started peritoneal dialysis, obviously after I was trained to go home, I remember I wasn't so scared of the peritoneal. I was always of the assumption that it's the less invasive mode of dialysis. So I wasn't so much scared. I was just curious as to what this whole process would be like. And I remember when I had my tube put in, and then the first time I had fluid put into my stomach, it felt like I drank like 10 bottles of water just sitting in my stomach. And I think for me, that was kind of the biggest adjustment I had to get used to, was having the fluid in my stomach. So I started doing the exchanges at home. I was working at the time, but I was off to train and prepare. And eventually, when I went back to work, I was lucky enough that my employer gave me an office, and I had a door that I could close the door, and I could go in and I could do my exchanges. So I would heat up the bags in the microwave, and then go back to my office, shut the door, do the dialysis, and then did it after work. So I did morning, lunch, supper, and then before bed. So that really made it easier for me to work and continue to maintain my day-to-day life. To had a few minor issues with the tube that was put in my stomach. It felt like every time the fluid drained, I felt some sort of irritation, I'll say at the bottom of my stomach, but that seemed to go away after I filled my stomach with the fluid. So, but outside of that, I never had any infections. I remember I'm a complete germaphobe, if I can use that word. So I remember always masking, always washing my hands, always making sure the site was clean, doing all that self-care to really ensure that I didn't end up with any infections or any kind of complications. So again, I was able, actually, so after I got used to doing it, I was able to travel. Speaking of travel, I was able to travel to Newfoundland to visit my grandparents. Yes, I got on the plane with my cycler, had the bags delivered to my grandparents' house in Newfoundland. Once I got there, Baxter had everything set up at the house. It was good to go. That was a good experience. I also traveled to Mexico. So for those of you who want to travel abroad, same sort of deal. Contacted Baxter. They did the whole set up at the resort with all the bags and everything. I just took my machine and did my dialysis while I was in Mexico. So the only downfall was with the placement of the tube in my stomach. I couldn't go in under the water, but being a taller guy, I certainly was able to go to the swim up bar and that kind of thing, but didn't partake, but just, was able to do that. So the flexibility to travel while on peritoneal was, in my opinion, was pretty good. You just have to be very prepared. No different than at your house with all the supplies when you're ordering, making sure that you're getting enough. I'm very, very detailed and very articulate with stuff at home. So I always made sure that I had a supply center set up in my closet. I was lucky enough to have a walk-in closet. So I kind of coined that my warehouse area and made sure that everything was there. I counted inventory, made sure I got my orders in on time so that I wasn't missing anything. All that kind of stuff. Now, I was a bit stubborn. I don't recommend, but being a young guy, I kind of wanted to move the boxes myself, and learned quickly that that's not a good idea, and did get help from my brother family to do that. But that was me being a bit stubborn. But so yeah, and then eventually, sorry, the freedom at home, like I said earlier, you can do the exchanges on kind of your schedule if you want. If you go to the cycler at night, there's that freedom throughout the day to do what you would normally do. So overall, I think for me, it wasn't a horrible experience, but I made sure that I made it, I guess, like brushing my teeth or having a shower. It just became a part of my day that almost blended in, and it was like, okay, this is something I have to do, no different than showering in the morning. So yeah, that was kind of my experience doing peritoneal. Did you want me to get into home hemo, or we?
Not yet. No.
Okay. So
it's coming.
Okay. Yeah. So those are the biggest things, I think, from my experience with peritoneal is the traveling and the self-care, making sure that not getting any infections and whatnot. So yeah. And then, sorry, last piece, I guess, educating others. So friends would come over, family, and say, hey, what is that? What's that tube? What are you doing? And, being able to explain to them the whole process kind of made me feel like I was kind of important or something in a way. Like I was like, oh, I'm here spreading knowledge to people that know nothing about it. And I didn't really know a lot about it, but was considered an expert, I suppose, in some ways. So yeah, so I enjoyed that part of it.
That's amazing, Justin. Thank you. And if I remember correctly, I believe you had 0 issues with infection and stuff because you were you paid so much attention to masking and hand washing, which was great. Yeah. So let's talk about hemodialysis. So unfortunately, at one point, peritoneal dialysis did stop working for Justin. So this is a picture of him on the hemodialysis machine. So we'll go through what hemodialysis looks like, and then we'll have Justin kind of chat about his journey to that point again. So hemodialysis, how does it work? Basically, what's happening is hemodialysis will pump your blood through a dialysis machine to remove the waste and excess fluid, then returns the clean blood back into your body. So when the kidneys are not working, that's one of their main things that they do is get rid of the excess waste and fluid. So then the dialysis takes over that process when the kidneys aren't working properly. So hemodialysis can be done at home or at a dialysis clinic or facility. Instead of traveling to a clinic or hospital, you and a caregiver can learn how to use the dialysis machine at home. And again, you would be very well trained, and the nurses will not send you home to do your own dialysis until you're safe and comfortable. Home hemodialysis can be done at night while you sleep. You can do it on your own schedule, which for a lot of people works very well. And generally, people do feel better when they do home dialysis than with doing dialysis at a clinic or a center or a hospital. Because with home hemodialysis, it can be done more frequently on your own schedule and often with fewer dietary and fluid restrictions. So to do hemodialysis, either hospital or home, we need to have access to large veins. This access can be in the form of a fistula in your arm, and it's surgically put in place. Sometimes in order to start dialysis on short notice, a person may have to have a catheter or a tube put into their, inserted in the large vein of their neck for temporary access. And then it can be, if they want the one in the arm, then that can be created later. So the fistula or graft must be created weeks to months before it is needed, but there's less chance of infection than with the line in the chest because there is nothing on the surface of the arm. So this is just quick pictures of what they look like. So the fistula in the arm, it's essentially what they're doing in surgery is joining an artery to a vein in the lower part of your arm usually. By doing that, that creates a larger blood vessel to be able to take the blood out easier to clean it. The other one would be a line in the chest. And it's this one would be, it goes into the main vein in the neck, going towards the heart. This one is the one that the doctors will use in an emergency situation as well. If a person presents to the hospital, needs to start dialysis immediately, and there's no other dialysis plan in place. This is you'll have the line in the chest. So with in-center hemodialysis, A lot of people will choose not to go to the dialysis, or sorry, will choose not to do dialysis at home, either the peritoneal or the hemodialysis, and instead will go to a hospital or a clinic where the trained nurses or technicians will be connecting them to the dialysis machine. In-center dialysis means you'll be traveling at least 3 times a week, sometimes at a great distance for your treatment, and you'll cover the transportation costs yourself. The time spent on in-center hemodialysis is typically 4 hours, not including the preparing to start dialysis and coming off the treatment. So you would be at the dialysis clinic or center, usually 3 days a week for 4 hours at a time. The dialysis unit would give you a schedule of when the days and times the dialysis would occur. So you'll plan your week and your activities around that schedule. In addition, you may have a daily fluid limit and a restricted diet in order to help your body manage the fluid and the waste buildup in between treatments. Because you would only be dialyzing 3 days a week, you often have to watch how much you drink, how much you eat. So is it the right choice? Some factors that may make having hemodialysis in a clinic a better choice for your situation, and it's just know that all of the treatment options work very well. So they all do a really good job of removing those toxins and water. So you want to pick the option that's right for you, that's going to work the best for you. So some factors that may make hemodialysis a better choice: a person that's physically or cognitively unable to do their own dialysis at home, may not have appropriate housing, lacking the support needed to do your treatment at home, you prefer to have the care team do your dialysis for you, or for people that have a complicated hemodialysis access, it's easier to go into the clinic for that. So what is the experience of hemodialysis like? Many in-center hemodialysis clients express that they're very tired after dialysis. That's the main thing that I usually hear, is that they're very tired. The dialysis process itself should not be painful, but aspects of it may be hard on the body. For example, if a client has too much fluid to remove during dialysis, their blood pressure may go down. They may also get headaches. So that's why it's really important to control the fluid intake that you have in between dialysis runs. Many people choose to do home dialysis or either peritoneal or home hemo to decrease those symptoms. With home dialysis that's happening more often, clients often feel better, and then of course appreciate being able to do it in their own environment, and typically don't experience those headaches and difficulty with their blood pressure. So Justin, eventually peritoneal dialysis unfortunately did not work for Justin anymore. So he did need to transition into in-center hemodialysis. So Justin, can you tell us a bit about what that looked like for you?
You betcha. So I remember when the peritoneal dialysis wasn't really effective. It was kind of a rush situation. Ended up going to the hospital, and I believe it was right before Father's Day weekend when I was told that I'd have to go to home hemo. And so for me, I'll admit, that was a bit scary. That one, I think I will say, like most people, were afraid of needles, and that's all I thought about was needles. So but I remember getting prepared. A lot of it happened really quickly. And I ended up in the Foothills Hospital in Calgary in, I guess you would call, like, I wouldn't say emergency dialysis, but I guess for lack of a better word, emergency dialysis. And it had a line put in my chest. And I remember looking around and thinking, I'm 31 years old, 32 years old. Like, this is not for me. And so the first couple treatments were quite exhausting. Like I think you mentioned earlier about tiredness and fatigue and whatnot. And so, once I'll kind of fast forward. So once I got set up on that, I ended up going to the community hospital to do dialysis 3 days a week, 4 hours, like you said, traveling back and forth. For me, I always, maybe it's stubborn, but I always wanted to maintain my life. So what I did for my dialysis, lucky enough, I worked not too far from the clinic where I trained. And so I would get up in the morning, go to work, and in the afternoon, I'd go to dialysis, and then I would go back to work, sometimes just go home. Eventually, when I went to do home dialysis, I did the training again. And when I went home, it was basically, before that, I'm skipping a step. When I did the evening treatments, I would go to work at 7 in the morning. I'd work till 4. I'd leave work. I'd go home and I'd dialyze from 6 till 10, Monday, Wednesday, Friday. And I did this for a period of time. And for me, it was something that I thought, I don't want to have this stuff at my house. I don't want to look at machines. I don't want to deal with it. I'll let somebody else needle me, take care of me, all that kind of stuff. And then eventually I kind of realized, after having conversations about, quality of life, being at home, being available for the family, what's a better option? So I entertained the idea of going home to do home dialysis. And, I'll say off the top, looking back on it now with what I know, I probably would have done that right from the get-go. But again, being new to it and not knowing, I think we're all afraid of the unknown, right? So, but looking back, I would have probably went straight to home hemo. But my experience at home, again, was more control. I dialyzed at night while I slept. And of course, the first few times are quite scary, but after you get used to it, you get the machine set up, you get yourself needled, you're all ready to go to bed. I can honestly say it wasn't as bad as I thought it was, or what it was going to be. And I remember, sitting there thinking, I could dialyze tonight if I want, maybe not. If I have an event tonight, I could dialyze tomorrow night. I tried to do 5 days a week, at least 7 hours an evening, to kind of get, I believe, if I remember correctly. And then there were times where we have a family weekend planned in Edmonton. So we would leave Calgary, I would dialyze, and then maybe I wouldn't dialyze till I got back Sunday evening. So it gave me some flexibility. And then if I had a during the week trip, or I was out of town, I could schedule my dialysis around what my lifestyle. So I didn't necessarily have to go, okay, I'm going to the clinic on this day. I have to plan around that. So it gave me a little more freedom to do my everyday things. I also, speaking of being alone, you mentioned, you're not alone, you're trained up. I know when I was doing it, there were times, as well as I think I handled it, there were times where I would be dialyzing or setting up to dialyze, and then 2 in the morning, something happens to my machine. I got to call a nurse. I call the nurse, and they would walk me through it. It would be okay. There were times where I sat on my bed, I'll admit it, in tears because I couldn't get the needle in my arm. And it's like, and you kind of learn to go through those things, and those things do happen. But I found that as I dealt with certain situations, the next time it happened, it got easier to deal with, and I was less afraid. So the first time the machine went beeping in the middle of the night, I went from mass panic to, okay, you know what, I know how to troubleshoot a little bit or slight adjustments, but I always felt, and I always knew that there was somebody there, whether, even though it's not my family, there was always a nurse there that I could call upon if I ever felt like I was alone, no matter what time of the night. So for me, that was a big thing to go to bed knowing that, I had somebody there. And again, back to, like I said, with peritoneal, I showed all my family my setup. I was proud of, what I had there, and educated everybody. And a lot of people had a lot of questions. So I invited them to come in and take a look and see what it is I do. And of course, at that time I had children as well, and they were curious to know what daddy was doing and what this machine was and whatnot. But being at home, I also really enjoyed the fact that I could spread out my king size bed and do my dialysis. Now I understand not everybody has that same option, but I think our beds at home, our chairs, our couches, or whatever you're using at home, by far exceed what you're going to be sitting in a hospital. And no offense to the hospitals, but being in the comfort of your own home, doing something, I think is way more comforting, in my opinion. And so getting over the fear, or getting over the idea of having machines and stuff in my house, I really embraced the fact that I kind of felt like I lived a normal life. Like I felt like, although I dialyzed at night when I was sleeping, I felt like I could do a lot of the things that I couldn't do when I was in the clinic. And so for me, that became kind of my life until luckily I got to the next step, and we'll talk about that later. But I think for me overall, if there's one thing, ask a lot of questions, but I think for me it would be, if I had to have my time back, I would have went to home dialysis right from the beginning, just going through it and knowing what it's about, and kind of understanding some of those fears now. I think, I would have probably went that way, but yeah, that's I know I kind of rushed through that, but there's so much in there. But just wanted to highlight the important things, or the things that I found effective, and how my life changed. And I had children. Like I said, I was married. I still worked. Um, you know, dialyzed every night. Went to work the next day. I had good days and bad days, and there were days I didn't want to dialyze, and I thought, what, this is tough, but just you find that one thing that gets you through the day, that you go, okay, I can do this, right? Like, this isn't going to be the end of, this is not going to define me. So how do I get to the next step? And I think day by day that just kept me motivated, and made me continue doing it, and try to live the best life that I could live, because I had family, I had friends, I had work, we all have different things that in our lives, and you draw upon that to gain inspiration to keep going. So yeah, that's kind of my experience in a nutshell. If there's anything I'm missing, Tracy, by all means, let me know. But
No, you covered it pretty good, Justin.
Okay.
That's amazing. And this is why Justin's always been so inspirational for me, is because he did go through all these options. And yeah, he had bad days, like he said, but he still managed to do them, and still managed to do the treatments and work and school and family. And so managed to fit dialysis into his world.
Yeah, and I
Thank you,
just wanted,
Justin.
actually, one more thing. I wanted to go, like, you don't have to go back, but that photo of me in the dialysis chair, that was, you mentioned my kidney march. So I actually did that during the kidney march. Walked the first day. The next day I got up and I walked, and then I went to the dialysis center, and then went back. So yeah, that picture it looks like me sitting in a chair doing dialysis, but there's a lot behind that photo that most people don't really know or understand. But yeah, I just wanted to highlight that. That's in my life, that's one of the iconic photos that I like to share with people. So
Yeah, absolutely. I mean, that's so impressive that you could do the kidney march, still go to dialysis, and still go back and do that march. That's incredible. You're amazing.
I'm
Okay, we'll
just
just
me.
move. Oh, sorry. What's that? Sorry.
I'm just me, just a regular guy.
Regular guy getting through all of this, which is fantastic. So Justin went through his experience with the home hemodialysis. So I'll just kind of give you a little bit of information about it. So you definitely have more flexibility when you want to do your dialysis. Like Justin mentioned, you can work it around your schedule. You have something to do, you do dialysis the next day. You're in charge of your own day-to-day care, with the benefit of the support from your dialysis team. And Justin highlighted that, which was fantastic to know that that team is there and accessible. So with home hemodialysis, a hemodialysis machine and a water system will need to be installed into your home. And this can be done for a lot of people that are renting as well. So that if you're renting, you can still think about doing home hemodialysis. Your home hemodialysis unit will cover the cost of installation of the machinery and arrange the necessary modifications to your home. So these two machines will need to be connected to your electricity and to your water. So that will be organized by the home hemodialysis clinic. The cost of the supplies will be covered by your provincial territorial medical insurance. So choosing a home-based dialysis option may make you feel, there's lots of emotions that you might go through when you're thinking about home dialysis. You might be worried about managing it on your own, and Justin kind of highlighted that pretty clearly. Uncertain about what you would do if an emergency arose, but he did, Justin mentioned that the team is there. He was able to call them and kind of get through that emergency. Might feel nervous. So what can you do about those to help with those concerns? Write your questions and your concerns down, talk with your kidney clinic, and talk with others who have chosen the type of dialysis you're interested in. Contact the Kidney Connect peer support program, and you'll be matched with a trained volunteer. And there's different ways that this can happen. It can happen by phone call, virtually, different ways peer support can happen. And Justin, gratefully and thankfully for us, has been a huge partner with the peer support program, and has helped many people over the years with his journey and helping them through their journey. And then also ask questions and share your concerns with your online community at kidneyconnect.ca if you're an online person. So we chatted a bit about, Justin went through kind of some of his experience with home hemodialysis. Do you have anything else to add for home hemodialysis, Justin?
No, I realized I jumped ahead. I apologize.
No,
I just
you did not. It was perfect timing.
got on a roll there.
No, that's good. It's your story that is important. So
Mhm. You know what? I think the biggest thing prior to going to home hemo is just ask a lot of questions. I think us as human beings, I think we're just naturally nervous about the unknown, and I think a lot like for me when I talk to people who are newly diagnosed, I find that just answering some of those questions, even if they're simple questions, it makes you feel more at peace or a little more willing to enter into to home dialysis. So as you go along, I ask a lot of questions, and I'm a big if my potassium is 5.5, what does that mean? What does that number mean? Right. So just yeah, I think that would be my biggest thing is ask a lot of questions and really try to figure out and talk to people who've done it and that kind of thing. So but yeah.
I think that's a really valuable point, Justin, just to be your own advocate and work with your team. Find out, it's your body. You want to know what's going on with it. So that's great. Thank you. So we're just going to talk a bit about transplant, and then we'll let Justin speak again. So ways to receive a kidney transplant. So what a kidney transplant basically means is that you receive a kidney from somebody either that's deceased or from somebody that's living. And if you have that kidney transplant from someone else, then you will not need dialysis. Transplant's not a cure for people, it's a treatment, but it's a really good treatment for a lot of people to be able to live without dialysis and live their life as they maybe did a little bit before. The other part with kidney transplant is a paired donation. So paired donation, sorry. So to get a kidney from somebody deceased, actually, you know what? Pardon me, I apologize. We're going to do that after. My apologies. Benefits of transplant. So better quality of life for a lot of people. As I mentioned, no more dialysis, improved health, a lot more energy for sure, less dietary restrictions, more time for travel, school, work, your family, more time for you. And then if you get a kidney, living donation kidney or a kidney from somebody that's living, there's often a shorter wait time for that to happen. Some challenges of kidney transplant. It's a lifestyle you got to become accustomed to with taking the medications. There is always the risk of rejection. So the doctors and the nurses in the transplant units and clinics will follow you very closely to hopefully mitigate those risks of rejection. There is lifelong use of the immunosuppressive medications. So those immunosuppressant medications are what's keeping your body from rejecting that kidney. And it's really important that you take those medications as prescribed and on time. For a lot of people, there could be a challenge as the pill burden because there is more medications that you're taking. There are some side effects to those immunosuppressants, which the team would go through with you. And just other health problems can come up, diabetes, infection, cancer, different things. So there are some challenges, but the transplant team definitely works with you to try to minimize any of those symptoms or any of those things that are going to happen. So what is deceased or cadaver kidney donation? So essentially a person who has died in the hospital while on life support from a brain injury and their heart has stopped. The family has consented to donation. That's a really important piece, is that the family's consented to donate those kidneys or those organs. Before organ donation can take place, strict medical criteria must be met. The donor goes through a very detailed assessment, and then the matching process to the recipient begins. Wait times for a recipient or the person getting the kidney can average about 3.5 years, give or take, but often the wait can be a little bit longer. So maybe around up to 5 years sometimes. And then the need for organ transplant exceeds the supply of available organs. So this part's really important as well. Deceased donor anonymity. The recipient will not know the donor's identity since there's a law in Canada to protect the anonymity of both the donor and the recipient. However, many transplant programs will forward letters of thanks or cards from the transplant recipient to the donor's family and vice versa. So there can be some communication that way. So what is living organ donation or kidney donation? So this occurs when a person freely decides to donate one of their kidneys. Kidney donation is the most frequent type of living organ donation and is the most successful of all transplant procedures, which is amazing. So who can donate? A living kidney donation often comes from family, but it can come from anybody. The big thing is that that person has to be over 18. They won't take a donor kidney from somebody that's under 18. So a good living donor candidate is somebody who's healthy with no existing medical conditions. The kidney paired donation program is a part of our program across Canada. So if you're a living donor, but that person's kidney is not going to be a match, you can still have a kidney transplant. Your donor will be able to donate, but not directly to you. And then you'll receive a donated kidney from a different donor. Okay. And then just an interesting fact, the first kidney paired donation with Canadian Blood Services in Northern Alberta Kidney Program, so that's north of Red Deer in Alberta, was on June 24th, 2009. So it's the paired program has opened up the availability of kidney transplants a lot by being able to donate to somebody else and then that person receiving another kidney. So we've made it to kidney transplant. So Justin, I think you have something to share with us.
You betcha. Yeah. So I was lucky enough to have my kidney transplant in October of 2013. How it came about, I wasn't really big on bugging people or talk, like just general talk. And for me, what happened was my cousin's wife had approached me one day and said she wanted to get tested. And she had seen a few Facebook posts and she knew, obviously being in the family, she heard a few things. And so she thought, hey, why not get tested? So yeah, I mean, we started out and it is a bit of a process, but when it was all said and done, we picked a date and we had the transplant, and yeah, it changed my life forever. It's been an absolute blessing, and for me, it's been able to try to think of what you had on the slide there, Tracy, but the benefits for me, definitely my lifestyle. I feel like I have, quote unquote, a normal life, what my life used to be like. I always had a dream to travel to the Philippines, and I kind of wanted to wait until I had been transplanted to avoid dialysis while traveling. I know I mentioned earlier I went to Mexico and Newfoundland on peritoneal, but going that far away, I was a little nervous. So after I had my transplant, we had booked a 3-week vacation with my wife's family to go to the Philippines, and just to be able to go and do the things I wanted to do and not have to worry about doing dialysis was really, really, it made my mind at ease, and I was able to enjoy a lot of the things. And in that, though, I had to make sure that I still took precautions, took my pills, watched what I ate and all that kind of stuff. So the traveling part's been good. I have 3 kids, as Jill said in the intro, and a granddaughter now. So being able to spend time with the kids, with their activities and those types of things. Obviously now with the transplant, I have more energy, better health, more time. So I'm trying to really focus on doing those things that I want to do with my family and friends that I otherwise couldn't have done or would have been limited to on dialysis. So our youngest now is 11, Nicholas. He was born 3 months after my transplant. So adjusting to a new kidney and having a new baby was interesting. But my donor's name is Nicola. We call her Nikki. And we named I don't want to get emotional. We named our son Nicholas in honor of her. So that was kind of cool. Yeah, so it's been really good. You did mention some of the some of the things that come with like pills and different can't think of the word now, but some of the issues with transplants. So, the pills is one thing, getting used to taking pills every day. I was never a pills person. So, making sure I take them on time, making sure I'm getting all my pills and all that stuff. I've had a few issues with my ankles and my bones, and I've noticed, I don't know if it's meds or not, but I've noticed that, I've sprained my ankle a few times, that kind of stuff that I didn't seem to notice before. But again, that could be a whole host of things. But there's a lot of things that you go through that you just kind of, it's part of the package, I suppose. And, I kind of tell people, if I have to take pills for the rest of my life, that's something I'm willing to do to have this kidney. So it's a small sacrifice in my mind. And yeah, trying to think of what else to. I'm trying to remember your slides there previously. It's been really good. I'm lucky enough to have a living donor and someone in the family, so we do get to see each other often. Send her flowers every year on the anniversary day, because it's one of those things where what do you do? How do you say thank you? I feel like I can never say thank you enough, but yeah, and just one of those things. I think about a transplant, and I think about the future, and I don't know if this is the right time, but maybe I'll just kind of bring up, after transplant, like, it's been 13 years, and I do kind of worry. No, I shouldn't say worry. I think about what happens one day if it doesn't last, right? And for me, I think that, what you talked about, as long as I'm taking my medications, I'm eating right, I exercise, if I can do all those things that I have control over, if something happens that's beyond my control, then at least I can say I did everything that I could have done or was supposed to do. So I don't really live with any fears about if it's going to fail or not. I just kind of, it's there. I think about it, but I don't let it consume me. And, there's times I sit down and I could be at work, I could be at a friend's house, I could be driving, and I just think about, I think to myself, like, wow, like I have a kidney transplant, like this is amazing. Like, and I just, in those moments, I just feel so much appreciation for my donor and this new life. And I don't know, like just little things like taking my kids to the store, or my wife and I going out for dinner, like it's there's so many things now in my life that are different for the better, that I have a true, genuine appreciation for anybody who has received one, and the donors out there, they're amazing. So at the risk of rambling on, if there's anything that you think of specifically that you wanted me to talk about regarding transplant, I can, but those are kind of the biggest things. And I guess another thing too, might be off topic, but one of the things that I find I enjoy about peer support is talking to other people. And even though I've been transplanted, I still like to talk to people about their experiences and go back to mine, because it kind of reminds me of where I came from and where I was and where I'm at now. So it also gives me that greater appreciation for kind of my life over the last 13, 15 years, and how far I've come and what I've done. So that's another big thing for me is just reflecting back. And I know not everybody has a good experience with it. We all have different experiences, but for me, it's about just, reflecting and realizing how far I've come and what I've done. Like I said, I feel like I'm just a regular guy, but I don't want to take away from my story, my life, but there's a great appreciation for where I'm at in transplant. So yeah.
That's amazing, Justin. And like all your words just resonate so well with me. And I'm so appreciative that you were able to tell everybody that. And just sort of on that, we just have a couple more slides and then we'll wrap it up for questions. The transplant may not be an option for everybody. So then it's important to decide on what treatment option you might want to pursue if you're unable to move forward with a kidney transplant. Thank you again, Justin. So again, in the end, for the most part, it's your choice. Choose that treatment that will best suit your medical and personal needs and will help you achieve your best possible quality of life. that's the important piece, is your quality of life and what's important to you. You can always switch treatments. So if you choose one treatment and you decide it's not working for you, then you can switch. And as we heard from Justin, he transitioned through all of the treatment options, so it can be done. And then just make sure you get the right information. If you're doing research online, please make sure you're using a reputable website such as the Kidney Foundation. The Kidney Foundation is a wealth of knowledge, lots of resources, lots of webinars. So please make sure you're using a reputable website for your kidney health information. And also remember that every person's kidney journey is unique to them. It's important to talk to your team, seek out that peer support that Justin was talking about, which is amazing, and choose the treatment option that will give you the best quality of life. So these are just a few of the resources available through the Kidney Foundation, their peer support, and then just their educational resources. So definitely, use the Kidney Foundation resources, use your kidney care team, use your friends, use any support system you can get. And I think that's the end. So Jill, I guess if there's any questions.
Thanks, Tracy, for that. Oh, it helps if you can see me. Thank you, Tracy and Justin. That was wonderful. I've even learned some things, and I just realized, Justin, I was thinking, how long have you been a peer support volunteer? And I was starting to count backwards and backwards and backwards and thought, yeah, how old is Nicholas? And then it was before that. I'm going to say 13 years, 14 years.
I feel like it. Yeah, it's been so long.
I know. So, but thank you. Definitely lots of questions coming in. So that's always a good sign. So let's move forward with that then. And so if you do have questions, I've been trying to answer and acknowledge questions as they're coming in. Might not be able to do that since we're reading out loud, but I do see them here. But there is the Q&A pane at the bottom of the video. And again, please don't share any info or personal information or questions in the chat. So I'm going to read out the questions to you for now. And in no particular order, well, actually, it is a particular order. It's the order that they came in. But I think combining some of the questions together into themes, one question that came in very early was about treatment choices for people who are 70 and up or a particular age. And so I think the theme around that is, what about treatment choices related to people who are older? Does it make a difference, Tracy, on the age of a person?
That's a good question. Not necessarily. Depending on where that person is in their life, they may or may not be able to do it like a home therapy. But no, age doesn't, we have people in their 80s and 90s that are doing home peritoneal or home hemodialysis. And we have younger people that are doing in-center dialysis. So I don't think the age matters so much. It might matter a bit more with regards to transplant. That might be a bit more of a concern, but generally for the actual dialysis. And then of course the nephrologist, when you speak to them, the nephrologist will let you know if they think that you're not able to do a treatment. If you choose a treatment and there's a reason why, they'll let you know.
Great.
Not sure if that answered that properly.
No, that's great. If there's some more questions or follow-up, we can always send that into the Q&A box. So from a family member, what if you're in a situation where you've got your family is your team, and you've got someone living with kidney disease and then their care partners, their family members? What if they disagree about what the best treatment choice should be? Does that happen, Tracy? And a lot? Okay.
It happens a lot. Yes, it does happen a lot.
Can you speak to that, please?
Oh boy, that's a tough one. That's hard when one person is choosing one thing and the other person or the family isn't. But I think it comes down to what that person that's dealing with it is, what their decision is. I know we often will have somebody that will want to choose conservative care where they don't want dialysis, but the family does want them to do dialysis. So that becomes a bit tough. It's a hard thing to navigate, but I think at the bottom line is it is that person's choice or that person's wish.
Great, thank you. Got a few questions here and there with some specifics about what I can and can't eat. Can people with kidney disease have alcohol? And I just wanted to maybe mention here, if you maybe want to speak to that, Tracy, but I have responded directly to some folks. But I think there is a little bit of an overarching piece about, if I have this, fill in the blank, does it mean I can't do X treatment? And so maybe we could tie that up with a comment really about, is there specific diet pieces that people have to avoid or not avoid on certain treatments? Someone asked about, can I have, if I have carpeting and cats, can I do home hemo? Or if they have a sensitivity to protein, can they have a transplant? Can you speak in general to some of those types of things?
So there's a lot of questions in there.
I understand. I just realized.
So the diet intake, I think, it varies through the different stages of kidney disease. So somebody with a higher kidney function of 60 will have a very different diet than somebody with a kidney or a kidney function of 10. And that's where it's important to follow with your dietitians, who will kind of help guide you as to what you should be drinking or eating. Generically, I will say that salt is the one thing you want to avoid, right? From starting dialysis or pre-dialysis to transplant. You want to avoid that salt intake as much as possible, because that can cause harm to those kidneys. And then you asked about protein with transplant. So, sorry, can you say that piece again?
Yeah. Can you maybe talk about cats and carpeting related to home hemo?
Okay.
I looked for that one.
So ideally, with either the peritoneal or the home hemo, you can usually still have your pets, but it's really important that the area that you're doing your dialysis in at home is clean. So those cats would need to stay out of that room. If they've been in that room before you start, it might be beneficial to get the carpet cleaned. It's just really important for infection that the cats or the dogs are away from where you're doing your actual dialysis.
Okay. And just a question, sorry, about that high sensitivity to protein. Does that mean that transplant's not an option?
Oh, no, definitely not. Okay. Yeah, transplant still can definitely be an option for sure.
Thanks.
That within the transplant team, there's also a dietitian that will work with you and they work with many different types of eating patterns to make what would work best for you.
And feel free, Justin, to jump in if anything resonates with you.
Absolutely.
I was just going to say, speaking of carpet, I have kind of a little, I don't know if it's funny, but when I was doing the cycler at home one night, very important to, I guess this is told in the training, but to clamp your lines. And so I had a bag at the bottom where all my exchanges were going into that I didn't have properly clamped. So I woke up the next morning with my bags all over my carpet in the bedroom. So definitely something that you want to make sure that you're paying attention to. I know even on home hemo, I've woke up at 4 a.m. and took out the needle and sprayed, and my carpet got it. So just little funny stories that I remember along the way, but related to carpet, since that came up.
Absolutely. And pets do definitely like the peritoneal fluid for sure. So you want to keep them away.
Oh, thank you. So again, lots and lots of questions now also coming through since we've started the Q&A. So I'm going to try to combine some together. Around peritoneal dialysis specifically, a lot of people asking if you could revisit how often you do it, the frequency, things like that. Specifically also about hooking it up, what that looks like, support when you're on PD. Could you guys talk a little bit about that, please?
Absolutely. I didn't go into a lot of detail on the individual therapies just because that's all provided during the training. But so with the peritoneal, because that liquid or that fluid can only stay in your abdominal cavity for no more than 6 hours, the two different ways. So the manual exchanges would be done 4 times a day. And as Justin mentioned, he was doing it at breakfast, lunch, supper, bedtime. Takes about 30 to 45 minutes, give or take, to do that actual process. So basically you're draining out the old liquid, the dirty liquid, and then putting the clean liquid back inside. And then the cycler or the machine at nighttime would do the dialysis in 8 hours overnight. Now, the one thing with peritoneal dialysis is it is actually a 24-hour-a-day dialysis. So you would have fluid in all the time. So with the cycler or the machine at night, usually when you disconnect in the morning, the machine will have put that fluid that can stay in for the entire day. So you're still getting the dialysis process, but you're not doing all the work for it. And then, sorry, Jill, can you repeat the rest of the question?
Just about, and maybe this is actually one for Justin as well. People were talking, like, if you switched from doing the exchanges 4 times a day, but then go to a cycler at night, what are some of those changes like for people? Or just, I'm not sure if you did the cycler, but if you have a particular treatment modality like PD and you switch it up, how you do it, is that hard to do? Is that something you need special assistance with?
No, I don't. For me, going from the 4 exchanges per day to the nighttime cycler, I don't think it was too big of a transition. It was basically, I guess, once you set up, I think the biggest thing is just setting everything up. And once you get everything set up, and it starts working, you just go to bed, right? Like I don't recall having any major issues with those 2 methods. Like I said, just making sure that you're clamping lines at night and that kind of thing. Now, what Tracy said is you're going to go from doing these exchanges 4 times a day to getting up in the morning, and that solution in your stomach is there all day, right? So you are carrying around that fluid, but you would be doing it, I guess, on 4 exchanges a day anyway. So I didn't think there was a big difference in the 2. Just as far as the actual process, just more extra time during the day to not have to do those exchanges. If you live a lifestyle where it's hard to, like I said earlier, luckily for me, I was in an office at work. I could shut the door. They made a little blind for me so that I could do it, and I was able to do the 4. Not everybody can do that, so maybe nighttime is the way to go. But yeah, not a lot of difference in those 2 methods.
Someone did ask about, can you switch back to 4 a day to the nighttime cycler? Can it be done basically concurrently, or do you have to stick with one or the other?
No, you can definitely switch back and forth. You just, you'd be trained on both. I actually had a young gentleman when I was working in the peritoneal clinic, and he was a tow truck driver. So when he was on call, he would go back to doing the manual exchanges during the day, the 4 times a day, because he didn't want to be on call and hooked up to his machine at night. So you can switch back and forth. And then for traveling, some, depending where you're going, some people may not take their cycler or their machine with them. So then they would do it the 4 times a day. So definitely you can switch back and forth.
Perfect. Maybe just move to some questions here around hemodialysis. So some questions just in general about if you have poor veins. People said, I have poor veins, or if you have poor veins, can you do hemodialysis?
So yeah, generally. So for sure. I mean, there's always the line in the chest. That's always sort of the default option. The one in the arm with somebody with poor veins, they're all going to be, people are always assessed by the surgeons that are going to be creating that fistula in the arm. So they'll do, they might do an ultrasound on that arm to see if those vessels are able to be connected to be used for the hemodialysis. They'll tell you if they can't do it. Perfect. Surgeons, yeah.
Okay, so a little bit about questions around if you live alone related to home hemo. If people have to cannulate, decannulate, or do you need assistance, or can home hemo be done if you don't have another person in the house with you?
It actually can be done when you live alone, and the benefit of doing it over more time, more days, longer hours, is that the machine is running slower. So a person that does live alone can actually do it by themselves. And when a person does the training with the home hemo unit, the nurses or whoever's doing the training will teach that person how to safely put those needles into that fistula. They're going to teach them how to be safe at home by themselves. So definitely it can be done by yourself, sorry.
Yeah, and I can say too, like, I did have, my wife was there and the children were young, but even though I had people with me, I would say that 99% of my time was myself anyway. I set everything up, I did everything, I managed it all. Like I said earlier, if I had questions, I'd phone the dialysis nurse at nighttime, but for the most part, it kind of was me on my own doing it anyway. So yeah.
Well, Justin, you've actually jumped into maybe a next question that someone posed specifically for you. So maybe you could tie two of them together. One is, maybe can you talk a little bit about what the home hemo training was like? Like, how long did it take? And also just about that, like how long, was that transition time from in-center hemo all through? So I guess that's how long did your training take, but till you were actually doing it alone by yourself at home. And then a little bit about what access is like a nurse at night you had from home.
Yeah, so I guess, Tracy, you can correct me if I'm wrong, but I think it's typically, is it a 6-week?
Usually, give or take.
Now. Yeah.
Yeah.
So I kind of caught on really quickly. I think if you're somebody who is able to catch on quick, like, it's not complicated. I think in the beginning, there's just a lot of steps. And I want to say the first time setting it up, maybe 45 minutes or 50 minutes, just maybe an hour, because I was nervous about and double checking my booklet on every single step. Then I got to a point where, like I mentioned earlier with peritoneal, it just became like brushing my teeth or having a shower. I just went in, got it set up, like it was like boom, 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 and it just, like, it still takes time, but it was much easier once I got accustomed to it. So yeah. Sorry, what was it again, Jill? The other one?
Supports. What kind of supports did you have at home? I mean, you mentioned about calling a nurse, but what else did you have as far as supports from home if something in the middle of the night happened?
Okay, yeah. Oh, and before I do that one, yeah, in my time, I think, if I'm not mistaken, I want to say probably, oh, Tracy, I hope I can say this, I think I was like 3 weeks. It didn't take me very long to catch on.
You were pretty quick.
I think, yeah, I think that's what I was told. So, being comfortable with it, I certainly don't encourage people to rush to get home. You want to make sure that you're comfortable, but I felt like at that time I had all the training, and the training is very extensive. I have to say, I feel like I got the best training possible. Like when I left there, I didn't think I had missed any, or nothing was missed. Like I had everything I needed to go home, and it was just a matter about me being comfortable enough to say, yes, I can do this. And so, took it on and said, okay, let's do it. Let's go home and let's get this going. So, so I was quite quick, but everybody's different. So, and then as far as the call, so nighttime calls were basically anything from when I'm setting up, there's something's beeping at me, and I believe, again, it's been a while, but I think there's some code error documents in your binder that you take home that tell you if this happens, I guess like a kind of a troubleshooting type document. So most of my calls would have been stuff like that. Or I do recall one night waking up and the machine just died. And I was like, oh, what do? I have all my blood in the lines. Oh my God, that's all my blood. What's going to happen? So that was one of the calls. And then I distinctly remember one very, very emotional night where I was trying to needle myself and I just couldn't get it to needle, and I was frustrated and I was tired. I think just everything was that day. And I'm on the phone bawling with the nurse, like, I can't do this. Why can't I do it? So having her kind of talk to me and calm me down and kind of say, you know what, it's okay. You don't have to do it tonight. Let's try it tomorrow. Just put the machine away and try to get a good night's sleep, and we'll talk tomorrow type of thing, was very, very helpful. So all those types of calls, machine related, during the day it's a bit different, but at nighttime, yeah, for sure. The on-call nurses were phenomenal and never ever once made me feel like I was bothering them by calling them. And it was 2 and 3 in the morning. And I'm tired, they're tired, and I understand that. But yeah, all different types of calls.
Awesome.
Yeah. And
Also, I
maybe,
think the machine technicians are on call as well to be able to help with like the actual machinery issues.
great.
That's correct.
And just to sort of build on to that, you know, I've noticed in some of the questions, people are saying bad veins, I have bad veins. And I think, and even needling, someone had said something about how, well, hang on a second, don't you have a fistula? Why do you have to needle? So obviously you could speak a little bit about the fistula, and that it is, to make, the access point bigger, but you still have to needle through the skin.
Right.
But related to that is questions about like how to get over, what if you have needle phobia? How do you get past that point of being able to poke yourself for dialysis?
That is a really good question, and that's a fear a lot of people have. But I know I can only speak to our home hemo unit, but our nurses are amazing at helping people overcome those fears and being able to put their own needles in. It's incredible actually to watch how somebody will get past those fears, be able to put those needles in. And then honestly, when a person starts being able to put their own needles in, they don't want anybody else to do it because they know if it's hurting or not. So it's just with the training and the time, and that's why the training is longer. So might be a little bit like maybe a little bit shorter if somebody has a central or a line in their chest, a little bit longer when you're learning how to put those needles in. But the nurses are amazing at getting people to do their own needles.
Do you want me to?
Yes, I sure
Yeah,
do.
yeah. I was one of those. That was my big reason for not wanting to go home. I was petrified. I remember the first time getting needled in the chair. I think I had my arms grabbing onto the chair so tight for that
Yeah.
4 hours that I think my shoulders were like sore for a couple of days. I remember one time, I think it was a senior nurse or an experienced nurse, and I had her so worked up that she didn't want to needle me, just because I was so paranoid of the needles. But I think, like Tracy said, through the training, being comfortable with it, knowing, and once you do it the first time, I feel like it's then you're kind of smooth sailing, because you kind of go to yourself, oh, that wasn't so bad, I did it. And then, not to say that every time is easy, but I think you definitely get to a point where you go, yeah. And now when I go for blood work, I wish I could do my own. Like Tracy said, I don't want somebody tried needling me one time in a clinic when I went, and I was kind of like, no, 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 let me do it. And you kind of become a little possessive over your access, because you're like, no, no, this is mine. Like, I know what to do. So definitely had the fears, but like I said earlier, I'm the kind of person that just, let's do it. Let's take it, and let's do it. So I kind of psyched myself up and said, Kate, we're going home, and this is what we're going to do. And I did it. And now I can watch it. I can watch myself getting needles. Blood work's not a problem. So yeah, but I don't think it's as bad as most people think, if I can say that.
Yeah.
Thank you. Let's talk a little bit about transplant. Tracy, is there some age restrictions around who can get a transplant? And related to that, someone is saying, a couple of people had mentioned about if you're an older person and you have someone maybe that might be a living donor, but they're younger, is that allowed? And, or, how do, if someone's offered a living kidney donor from someone who's younger, maybe in their family, but they are older, just wrestling with some thoughts around, if that's the right thing to do.
Oh, that's a good question. So, with transplant, with age, I mean, with any transplant, every recipient is evaluated by the medical team to be suitable for to receive that kidney. One of the big things that they're going to look at is a person's heart. They want to make sure a person's heart is in good enough shape to survive surgery and to support that new organ that they're getting. Now, as far as getting a kidney from somebody younger, that's fine. With the transplant workup, the team will do a full workup on the person that's donating the kidney and the person that's getting the kidney. So if that younger person's kidney is healthy and that person is healthy, then definitely they can donate to that older person. The person that's donating the kidney needs to be 100% healthy. So if when they do the workup, the team finds anything that isn't making that person 100% healthy, then that person may not be eligible to donate a kidney. They don't want to take a kidney from somebody and cause harm to that person, so they make sure that person's 100% healthy. Yeah.
And no, yeah, so no issues as far as really about the health and the kidney itself, and not necessarily
Correct.
the age. Okay.
Correct.
Okay.
Just has to be over 18. The donor has to be over 18. That's the big criteria.
Okay. Someone was asking about incremental dialysis. Is that something you're familiar with, Tracy?
It is, yeah.
Okay,
It
so
is.
what is that, and is it who would that benefit?
So typically, I mean, incremental can be done sort of through all of the dialysis options, but typically it's going to be with the hemodialysis for the most part. And what that usually means is that they'll start a person on hemodialysis maybe 2 times a week instead of 3. So for a lot of people, they may not need 3 times a week dialysis. So that person can start less often, doing less dialysis. They'd be monitored, blood work, urines. They'll monitor that person. Eventually, that person may have to move to doing the hemodialysis 3 times a week.
Okay, perfect. Thank you. So what are some of the causes that make peritoneal dialysis stop working?
Oh, quite good. Justin, do you want to answer that first? And what
I
happened
don't,
for you?
I don't, I'll
Okay.
answer it as a patient would. I don't know specifically. All I was told, it just wasn't as effective, and I can only assume that the fluid in there just wasn't grabbing enough of the toxin. But as to why it wasn't, I can't recall.
Okay.
Yeah, sorry.
No worries. So with peritoneal dialysis, as I mentioned before, there's that membrane inside our tummy, and that membrane is what is being used as the filter to bring the toxins in the water across that filter to clean the blood, basically. Over time, that filter may stop working, may not be able to do the dialysis as much or as easy as it used to be able to. And one of the things that affects that filter, which wasn't your fault, your issue, Justin, because you never had any, but if a person has a lot of infections inside, that can cause scarring around that membrane or that filter. And anywhere there's scar tissue, the fluid and the waste products won't go across that membrane as effectively. The other thing that happens is the membrane just stops working. It's a natural membrane within our body, so it just stops working. And I think that's what happened with you, Justin. It just stopped working. You didn't have infections or anything like that, as you mentioned. So yeah, I don't know if that answered that appropriately.
Mm-hmm. Yeah, I think, thank you for that. And I think, there's so many questions. So maybe we'll just fit in one more, because it just kind of the same sort of thing came up here and there.
Sorry, Jill, can I just make a comment before you move on? All of those sort of detail information about the actual procedures themselves, the troubleshooting, the pros, the cons, those will all be discussed with the care team. If you're doing the dialysis education with somebody, that'll be met. A lot of that'll be gone through there. And then when you get to the dialysis clinics, they're going to go through all the alarms, all the things that can happen, all the, everything that you need to learn. So you're going to learn everything that you would need to know, I promise. Sorry.
Perfect. Thank you. And that's sort of where I was going to come to a little bit as well. People had very general questions or a larger scenario with multiple questions in it. And so thank you so much to both of you. What I would say is, as Tracy said, if you're part of a hospital program, reach out to someone like Tracy or your care team to ask those specific questions. Please don't forget, the Kidney Foundation has lots of resources. call your local Kidney Foundation branch office. If we can't answer the question, one thing we're really good at is helping navigate, especially in your local area, to connect you with the right folks. It is daunting. Some of the questions are multifaceted, so we are able to talk it out with you and give you that information. And we also have, of course, our peer support groups right now. There's a specific one for like home hemodialysis. So please go onto our website and check out the schedule for that. And if you didn't have your question answered, which is many people actually, again, reach out to us. We have an email address that'll be posted on the chat if you want to send a question that way, and it'll be redirected. But thanks again. This really concludes our session.